Hi, this is Dr. Bernstein with our March 2017 edition of our teleseminar. Before we start, I want to give you the usual warning that my answers to your questions are merely guesses because I don't have your full medical history. I have not examined you, and it's really quite impossible to give accurate answers to personal questions under those conditions. Therefore, these teleseminars are for general information for all of the listeners, not really to solve the problem of an individual listener. Our special subject for today is to mention a new product that recently came on the market that I'm very enthusiastic about. It's a new lancet for sticking fingers. It looks just like the old ones. I'll show it to you. Here it is. No different in appearance, but has two particular features that are unique. One is that experiments were conducted to arrive at the right gauge of wire to use for the lancets, and also to work out the right angle that would be least painful, yet would not dull readily. Remember, most lancets are designed to be thrown away after one use, so they get dull, they get hooks, and so on. This lancet not only has the right combination of angle and gauge, but it also has been annealed. That is, the steel has been heat treated to make it less likely for the tip to be injured. So it lasts for multiple finger sticks or wherever you stick, and is the closest thing to painless that I've yet experienced. First question: how important is blood glucose reading 1 hour after a meal? Should I just ignore it even if it is very high, as long as 2 hour post-meal reading is a reasonable number? Well, I have a theme that I keep repeating over and over, and that is that diabetics are entitled to the same blood sugars as non-diabetics. And the implication is that if a non-diabetic eats a reasonable meal, a diabetic should have the same blood sugars as the non-diabetic. And most non-diabetics on traditional meals, not modern high carbohydrate meals, most non-diabetics on traditional meals don't have blood sugar elevations. They stay pretty much constant. And that's what we should experience. The higher your blood sugar, the more the hazards over the long term. And even if it's only for a few hours after each meal, it adds up over time. Now, most doctors don't agree with this. The ADA is very much opposed to this, and as you know, they recommend very high carbohydrate diets, knowing that they're going to get very high blood sugars after meals, and maybe even for most of the day. What is your view on a limited carb diet during pregnancy? Well, there's no reason why pregnant women should be exposed, and fetuses should be exposed to high blood sugars. So it's essential to have a very limited carb diet during pregnancy. In fact, many studies have been reported by Lois Jovanovich, MD, over the years, over the past probably 40 years, showing that women who have normal blood sugars during pregnancy do not get the fetal malformations and other complications that are so common in diabetic pregnancies. And she puts her women on low carb diets, very low carb diets. So this is essential for a safe pregnancy. And I might add that when I've seen my patients put in the hands of obstetricians who insisted upon ADA diets, I've seen disasters occur. Could you suggest an alternative to soy flour? As my doctor suggested, I limit soy, or any other suggestions for people with thyroid issues? Well, we know that unfermented soy can affect the absorption of thyroid hormone from tablets, and can also affect the behavior of deiodinases. So, yeah, if you have thyroid problems, and maybe in general, it's not a good idea to overload on unfermented soy products. And insofar as flour goes, the only thing I was able to think of offhand would be almond flour. There may be others that I don't know of, but certainly almond flour would be a good substitute. Next question. Diagnosed type 1 a month ago. His tests, I guess this is a son, his tests showed he has very little beta cells. He has allergy to raw fruits, vegetables, peanuts, legumes, and beans. Cooked vegetables make him sick. How do we get more micronutrients into his diet? Well, first of all, you might want to try other nuts than peanuts. For example, pistachio nuts, macadamia nuts, almonds, all the while counting the carbohydrate and keeping it in low limits. In my book, Diabetes Solution, we have a list of benign vegetables, benign in terms of carbohydrate content, and there are probably at least 30 vegetables on the list, including many I've never seen. And you could try them one at a time, either cooked or uncooked, and see how he responds to them. So the book Diabetes Solution would be helpful. Can you explain the dawn effect and how best to manage blood sugars with this problem? Well, the dawn phenomenon has been described in my book, Diabetes Solution. We also have a video on it on Dr. Bernstein's Diabetes University. So it shouldn't be necessary for me to again talk about it. It's a lengthy discussion, and the video on this subject is excellent. If a person has hypoglycemia and is not diabetic, is there risk for becoming a diabetic higher than normal? Yes. In fact, reactive hypoglycemia is very frequently a precursor to diabetes. So there are people who will eat something sweet, their blood sugars will shoot up and then plummet downward. And that's a good predictor of a fair chance of developing diabetes, usually type 2 diabetes. How, as a parent of a type 1 diabetic, do I get my 14-year-old son to understand that letting his sugar go to 329 and not doing anything about it for several hours will cause long-term problems? Well, you should explain to him the long-term complications of diabetes. There becomes a time in a kid's life when he has to know the score. Mostly parents hide this information from their kids, but they do get to an age where they have to be told the truth, that this disease, if poorly controlled, is not only a fatal disease, but a disease that causes many physical problems that can be painful and agonizing in many respects. And the only way out of it is to have normal blood sugars. Now, if you visit on the internet type 1 grit, G-R-I-T, you'll probably come across some articles that show the damage to the brains of children who have been exposed to high blood sugars, and also damage the brains of adults who are chronically exposed to high blood sugars. So not only are things like kidneys and eyes and reproductive organs affected by high blood sugars, but even the brain is seriously damaged by elevated blood sugars. And the brains of kids who have had high blood sugars for many years are smaller, their IQs go down, and a number of problems occur in the brain. And this information may be documented on type 1 grid. I may have had some of these articles presented on some of my Diabetes University videos, but I'm not sure. Are the antioxidants in berries worth any raise in blood sugar? I would say absolutely not. I haven't had berries in at least 50 years, I guess, since 1969. So that would be 48 years. And I'm in better shape than most non-diabetics who are 10, 15 years younger than me. So I don't know what those antioxidants would have done for me. There are also potential hazards to antioxidants. What's the best way to lighten coffee besides using half and half? Half and half is half cream, half milk. Well, the best way would be heavy cream, which is what I use. There are several advantages. One is that it turns out to be cheaper because you use less of it because it has more lightning power. The other is that it tastes better. And the third is that it has 1/3 the carbohydrate content of milk. So it has less carbo. What is more important, glycemic index or glycemic load? These are two indices that have been used to generate misinformation. The glycemic index is a measure of the amount that a certain food will raise blood sugar in a non-diabetic compared to bread, which, by the way, raises blood sugar more than pure glucose. So they take a ratio of the blood sugar increase in a non-diabetic. But most non-diabetics, especially with the small amounts of food that they use in checking the glycemic index, non-diabetics not going to show much of a blood sugar increase. Yet, with a very small amount of the foods that they're testing, I will show a huge blood sugar increase because I'm diabetic. So where peanuts supposedly have a very low glycemic index of 15%, a bag of peanuts will raise my blood sugar by something like 200 milligrams per deciliter, which is a huge amount, even though they say it has a low glycemic index. So it's a meaningless number when it comes to diabetics. And glycemic load is a measure of the total carbohydrate in a product, I believe unrelated to blood sugar. So all you have to do is look at the total carbohydrate content And you don't have to look at a number that's been calculated by different formulas by different people. Are there any vitamins or supplements that you recommend to help in reducing my A1C from 6.6 to 5.3%? As I say over and over, there's no magic in the treating of diabetes. There are no supplements that really have a significant effect. Well, I can retract that. There are two, but there are potential problems. One is fenugreek, which is widely used in Israel and maybe in several other countries in that part of the world. And these seeds, if you use the pure fenugreek, you stink to high heaven, and the whole area around you will stink. But I understand they now have destinkified fenugreek, and that may be available, and it may have some effect on blood sugars. I don't know about side effects or adverse effects. There's also a metal, and I forgot the name of it, which has been shown to lower blood sugar by inhibiting phosphatase, which is an essential enzyme that occurs throughout the body. I'm trying to think of the name of the metal. It's sold as a salt of the metal. In any event, I can't remember it offhand. The trouble is that it should probably be avoided because it inhibits an enzyme that's essential for many chemical reactions in the body and therefore could be hazardous. I don't know of other supplements that will significantly affect blood sugar. And of course, there's nothing that affects it as much as a low carbohydrate diet, which may not be enough. You may need medications beside. Please mention the names of the meters you say are the most accurate. Well, I've been using now for a year or two the Freestyle Freedom and the Freestyle Freedom Lite, which are identical except in size, battery usage, and minor differences. There's another meter that we are testing right now that looks pretty good. It's called the Contour Next One, O-N-E. Here's the device. It may be just as accurate, but it requires twice the amount of blood. And for many of us, many diabetics have Raynaud's phenomenon and don't bleed that easily from finger sticks. So it's important to us to not require a lot of blood. Recently diagnosed type 2 with an A1C of 9.7%, was put on metformin 2,000 milligrams a day and Galvis 50 milligrams. By the way, Galvis is a mixture of vitagliptin, which is an SGL2 inhibitor, and metformin. So it's a mixture of two drugs. And this patient's doctor is giving her both a mixture of metformin and vitagliptin plus additional metformin. Why? I don't know. This whole class of drugs has potential hazards associated with it. They work by causing you to, by lowering the renal threshold for glucose so that the kidneys pee away glucose at lower blood sugars than you'd usually expect. So instead of peeing away at a blood sugar of 170, you might be peeing glucose away at 130, thereby lowering your blood sugar, but also increasing your risk of urinary tract infections and also increasing your risk of dehydration. Anyway, getting back to the question, on low-carb diet, my fasting is in low 70s and after meals in low 80s. Should I ask my doctor to stop the metformin or the Galvus? Well, I would stop the Galvus and see what happens. If only because it has the potential for adverse effects. My daughter has type 1, doing a low-carb diet for 2 years. LDL is 150. I heard that only 1 to 2% of diabetics will have an increase in LDL while on a low-carb diet. Do you know anything about this, and do you have a solution? Well, I no longer look at LDL because many studies have shown it not to be a risk factor for anything. The risk factors for heart disease are more related to inflammation, like C-reactive protein, fibrinogen, which is also related to blood clotting, especially lipoprotein small a, and there are a number of factors that are far more likely to be related to heart disease than LDL. So I just don't worry about it, and I don't think that I've tested mine for maybe 30 years or so. And back when I was testing it, it was an experimental test. I was one of the first people to use it, but it turns out the literature shows is of very little value. How often do you inject yourself on an average day? Well, if I eat 3 meals, I'll have a shot for each meal and a shot of Tresiba on arising, a shot of Tresiba on bedtime. So that means at least 5 shots a day. If I need a correction, I'll take another shot for that correction. Now, because I'm getting gamma globulin, as I explain in my book, I'm at higher risk for hypoglycemia, and that makes my blood sugars a bit harder to control than before I started getting gamma globulin. So I might, on average, get 1 extra shot a day, which would be 6 shots if I have 3 meals. Unfortunately, I'm so busy with my medical practice that I rarely get a chance to eat lunch during the week. And then on weekends, when I go to the gym, I likewise never get a chance to eat lunch. So I'm stuck with 2 meals a day, and therefore get 4 shots plus maybe an extra one for a correction. My daughter has had type 1 diabetes for 10 years, A1C of 6.8%, which is an average of 172 milligram per deciliter. Uses only Humulin R with steady blood sugar. MD wants her on basal lantus. Your comments. Wait, this daughter has not had type 1 for 10 years. She's 10 years old, so she's a new type 1. And indeed, there may be value to basal lantus to help keep her blood sugar steady, but I would much prefer an insulin that doesn't bring with it the risk of cancer like lantus does. So I would prefer Tresiba, which is easier to use, gives steadier, more level blood sugars too. So he might want to consider a small dose of Tresiba. You can only get it in 1 unit shots in a Tresiba pen. I'm not, and the vials are available separate from the pen. So you can draw Tresiba into an insulin syringe and get half unit doses. So I would try that rather than Lantus. How dangerous are the preservatives such as creosol in insulin? Which one is the safest? Well, I don't even remember which insulins have which preservatives. The amount that's put in them is very minute. I haven't heard of any adverse effects from the preservatives. So I think this is a non-problem. I might add that the smell of most insulins to me resembles formalin, which is also used as a preservative. Is 6, 12, and 12 carbs healthy for a 5-year-old weighing 60 pounds with a high level of ketones of her urine and a blood sugar of 166? Well, 166 is pretty darn high and certainly not good for the growing brain of a 5-year-old child. And 6, 12, and 12 is probably double the amount of carbohydrate that she should be getting. I came up with a 6, 12, and 12 for an adult. And if you read my book, Diabetes Solution, you'll realize that it should be reduced in proportion to body weight. So we use 6, 12, and 12 for, say, a 140-pound adult. And for a kid who weighs, let's say, 35 pounds, it would be a quarter of 6, 12, and 12. So that would be very little carbohydrate. I'm a low-carb type 1 with Hashimoto's thyroiditis. Cheese sends my blood sugar up. Well, cheese will send the blood sugar of any type 1 diabetic up. In fact, any food will raise your blood sugar. This person probably has not read my book, Diabetes Solution, or he or she would realize that for type 1s, any food will raise blood sugar and you have to cover them with insulin. 1 ounce of cheese can increase my blood sugar by 20 milligrams per deciliter. That's probably about right. In fact, that's about what 1 ounce raises mine. What causes this? Is this possibly a casein reaction or allergy? I don't experience gastric upset. You absolutely should read my book, Diabetes Solution. This is caused by 2 things. It's caused by gluconeogenesis, because with inadequate insulin, we convert protein to glucose. We even convert our own muscles to glucose. And the other factor is the GLP-1 effect, which is described in my book, where a type 1 diabetic could eat pebbles, and just by distending his gut, his blood sugar would go up. Next question. Have you ever heard of using sodium bicarbonate and molasses in hot water for improving blood sugars? I never heard of it, but it's a very nice way of killing diabetics. Type 1 for 18 years. Control good until I became hypothyroid. I believe I am developing gastroparesis and overnight sugars are high when I test in the morning. And when I take extra insulin at night, I wake up dangerously low, confused, willing to try anything. And yet another person who should read my book, Diabetes Solution. Now, it's interesting that I conduct my teleseminars or I initially conducted them, to answer questions that were not answered in my book. But as things turn out, most of the questions would have been answered if the listeners had read my book. And I'm certainly not going to go into the details of the dawn phenomenon or gastroparesis right now. They're covered very thoroughly in the book. How important is LDL particle size? Well, according to the scientific literature, it's more important than total LDL, but in the modern literature of relatively small significance. So much more interested in looking at things like coronary artery calcium score, which is an imaging study, and at immune factors that reflect inflammation, as I've said before. These are much more potent. In fact, it's been discovered that the effect of statins on increasing life stems not from the fact that they reduce LDL, but from the fact that they reduce inflammatory markers. They reduce inflammation. And therefore, the implication is that it's likely that other medications that reduce inflammation and are safer than statins might be more appropriate for preventing heart disease. Now, you have to watch out when you get to anti-inflammatory medications, because you may get involved with non-steroidal anti-inflammatory drugs, which have a host of their own adverse effects and should not be chronically used. Next question. Mother has type 2 diabetes and is close to being placed on dialysis. After reading your studies and watching videos, it seems like she may be getting bad information from her doctor. What type of questions should we be asking our doctors if we're unsure about their recommendations without telling them how to do their jobs? Well, first of all, what's the status of her blood sugar control? If no one is attempting to keep normal blood sugars, you can be sure that she's going to go down the tubes, and the higher her blood sugars, the more rapidly, and the lower her creatinine clearance or glomerular filtration rate, the more rapidly she's going to go down the tubes. Those two factors are the key factors. So you certainly should know, you should ask them what her glomerular filtration rate, or GFR, is. If it is under 10, the chances are she's going to need to go on dialysis pretty soon. If it's under 5, she'll certainly need dialysis soon. If it's over 15, there's a good chance that it can be postponed. And recent studies have shown that the longer you postpone dialysis without causing harm, the longer these patients live, and the longer their kidneys last. Why? I don't know, but that's what the recent scientific literature shows. So she certainly should ask what their GFR is, what her GFR is. Can stressful dreams cause elevated morning blood sugars? That's a very interesting question, and I don't know the answer. I have had stressful dreams, and have not frequently, but there were periods in my life when I was exposed to a lot of stressful dreams, and I was under a lot of daytime stress, and I don't remember them affecting my blood sugars. But That's only one person. I just don't know. Type 1 for 19 years. On Victoza for 1.5 years. I love it, even though I don't need to lose weight. It helped reduce the feeling of wanting to eat all of the time, and blood sugar slightly more stable. Well, this is why we use it. I use it to curb overeating. Its effects have worn off. Any suggestions how to restart the positive effects of Victoza? Now, I've been told to take time off and restart. Well, this is what we've found with most patients, namely that the GLP-1 agonists, actually many substances that curb overeating, we found to wear off over time. Not for everybody, but for many people. And what we do is try substituting an alternate substance, and then even another alternate substance when the second one wears off. And then eventually go back to the first substance. So I have rotated patients on Victoza, Byetta, Amylin, and with some degree of success. With many patients, the rotation works. With other patients, it doesn't work. Sometimes I will jump to a totally different substance. So, for example, I have several people who were controlled on Victoza or Byetta, and they're no longer working, and rotating stopped working, so we've tried Bauhinia and other substances. So it's a matter of trial and error. And we do mention this in my book, Diabetes Solution. We don't measure the Bauhinia, but we do mention the rotation. In fact, I had a patent years ago on rotating anorexians for the treatment of overeating. And I didn't know what to do with it. I had to pay $600 to renew it every few years. I didn't want to keep paying the $600, so I let the patent lapse, but it's still hanging on the wall in my office. Next question. 47 years old, 4 months after getting my blood sugar controlled by low-carbo, high-fat diet only. Well, again, I do not favor a low-carbo, high-fat diet. I favor a low-carb, high-protein diet. If you go to a high-fat diet and restrict your proteins, you're going to get muscle breakdown, and that's dangerous. In any event, let's see what this person is asking. I was hit by peripheral neuropathy, damage to my sensory and motor nerves. My blood flow to feet is extremely low, almost non-existent, and I wonder how the patient found this out. Did he have Doppler studies? Did they use oscillometry? I don't know. A1C is 5.5 a month after the pain started. What can I do? How long does it take to get blood flow back? What can I do? Something is missing here. This person apparently had high blood sugars for many years, and the fact that he got his blood sugars controlled by a low carbohydrate diet makes me suspicious that what he calls control may not be that great. Now, an A1C of 5.6 is slightly elevated. I'm sorry, 5.5, an average blood sugar of about 120. The circulation doesn't magically improve when you control blood sugars. It may stop getting worse, But I was director of the peripheral vascular disease laboratory of a major hospital, and my best trick for improving circulation was what I call, we could call it toe presses or heel raises. I would have patients, most of whom lived in buildings without elevators, but they had staircases, step on the edge of a step, have their toes on the edge of the step, hold on to the railing, and raise their heels as high as they can, then down as low as they could, and do that initially for as many reps as they can do every hour. And eventually they could do more and more reps. And eventually they could walk further and further without pain. Those who have access to a gym could do toe presses on a weightlifting machine. And that was really the only thing that I used to improve circulation. Sometimes to get them started, I would give them L-arginine 2 grams a day, which would temporarily help the circulation so that they could do the exercise. This approach worked, but they had to have normal blood sugars. If they didn't, things would deteriorate. Next question. Type 1, 3 years old, diagnosed 3 months ago, managed perfect blood sugars on 4 units Lantus on your diet. Doctor wants me to have more insulin to put more weight on. Your thoughts? The game plan should be to have normal blood sugars, but to put weight on, you need both protein and insulin. So you would, number 1, read my book, Diabetes Solution. Number 2, increase dietary protein and increase the mealtime insulin to cover the dietary protein. Next question. Type 1, 64-year-old female. I switched from using a Medtronic pump to Tresiba insulin to hopefully gain higher control, tighter control. My A1C was 5.6 prior to switching. However, I am experiencing random heart palpitations, often waking in the middle of the night. Are palpitations a side effect of Tresiba? Not to my knowledge, but if you have blood sugars that are lower than they were before, you might experience signs of hypoglycemia, even if your blood sugars are in the normal range, or even if they're higher than normal, but significantly below what they had been before. So you get a pseudo hypoglycemia because you got used to higher blood sugars. That's a real possibility. The A1C was 5.6 prior to switching, which means an average blood sugar of 124. And if it came down to an average of, let's say, 83, that's enough of a drop that you could experience these symptoms. Can your book be used for a newly diagnosed 2-year-old child with type 1? Absolutely. In fact, it's essential for the well-being of this child. Kids with type 1 diabetes are usually mistreated, and that is medically mistreated, and don't fare very well. So use my book and let them be a survivor. Next question. Except for fresh green beans in the summer, I dislike most low-carb vegetables. Would alfalfa sprouts be an acceptable substitute, like a handful on my salad each night? Absolutely, no problem whatsoever. And you might take a look at my book, Diabetes Solution, or at my other book, Diabetes Diet, where we have a list of many vegetables that are low in carbohydrate. And you might find some other ones that you might like that you've never tried before. Let's see. My body has plaque built up in my arteries, blockage in my carotids, my kidneys, and more. Will this way of life get rid of the blockage? I had a bad stroke 12 years ago. Well, I assume that this way of life is what I recommend in my book, but I'm not sure. And to my knowledge, just normalizing blood sugar may not get rid of blockages in arteries, but the combination of normal blood sugar and strenuous exercise might get rid of blockages in certain arteries, like coronary arteries. Trouble is that if you already have blockages, you could kill yourself by strenuous exercise. So it has to be under the supervision of a physician and done very carefully. What is your recommendation on glucose levels during a high-fat diet or a fast exceeding 24 hours? I don't understand the purpose of either. A high-fat, low-protein diet is potentially dangerous, causes loss of muscle mass. Fasts, likewise, cause simultaneous loss of both fat and muscle, but people who fast tend to regain fat much more rapidly than they rebuild muscle. So I see no purpose for either of these. And if this is a diabetic, I certainly don't recommend it. And to ask what is my recommendation on glucose levels, I recommend that blood sugars be normal for everybody. And since the literature shows that minimum mortality occurs at blood sugars around 83, that's epidemiologic data. That's what I recommend for most people most of the time. Why doesn't Dr. Bernstein see children under 6? For a very good reason. Because many parents insist upon having an endocrinologist in addition to me, and the endocrinologists frequently advocate things that are harmful for children and dangerously harmful for very small children. Things like high carbohydrate diets, high blood sugars, insulin pumps, and so on. So what can happen is that I'm on the list of doctors for this young child, but the parents are following the instructions of someone else. Something terrible happens to the kid, and the lawyers come in and sue every doctor in the chart. And I end up getting sued for something that someone else did. And since this is especially hazardous for young children, I have to be careful. We appreciate it's an extreme diet that we may not achieve for some time with a 2-year-old, but we would like the opportunity to at least try. Well, you don't need me to try it. I wrote my book for people who can't afford to travel to see me, who can't afford to pay medical fees for the many, many hours that I spend with a new patient. So there's no reason not to use the book. My son is 50 years old and diagnosed with type 1 diabetes end of last year. He is currently on your low carbohydrate, high fat diet, which is not my diet. I don't advocate a high fat, I advocate high protein. And I reiterate again that avoiding the protein is a dangerous move. Has readings of 81 milligram per deciliter to 106. Has worried about his ketone reading of 2.7. Should this be a concern to him? No. Ketones are only worth looking at if you have extremely high blood sugars and a dehydrating illness. To routinely check ketones is a frivolous activity. I've had diabetes 71 years, haven't checked ketones since I started monitoring my own blood sugars, and no longer experienced ketoacidosis. And I should say, and since I went on a low carbohydrate diet. So I have no idea what my serum or urine ketones are, but again, I'm going to be shortly, I'll be 83 years old, and I'm in better physical condition than men who are 15, 20 years younger than me. And you could look at videos of me exercising on Dr. Bernstein's Diabetes University, and you could see that testing for ketones are unlikely to have been of any benefit to me. Is low carb safe for 12-year-old? How many carbs a day? Well, someone earlier asked if it was safe for a 5-year-old. If it's a 12-year-old diabetic, it's essential. And you got to read my book, Diabetes Solution. And you got to adjust the amount of carbohydrate to the weight of the kid. We use 6-12-12 for adults weighing around 140 pounds, and children get less. Can benfotiamine can benfotiamine and methyl B12 help with nerve regrowth? I doubt that B12 can, and my recollection is that benfotiamine has been used to slightly lower blood sugar, maybe help beta cell replication, but really the game plan for treating diabetic neuropathies is to keep blood sugars normal, and the neuropathies do reverse with absolutely normal blood sugars, but it takes time. A1C of 6.5%, that's an average of 160 milligrams per deciliter, but always feeling weak, with low energy and sexual desire. My thyroid results, patient tells his thyroid results, and nowhere is there an appropriate thyroid test done. As with many other physicians, this patient's physician tested everything but the right test. The most important test is the free T3, which is the active hormone, and that was not tested. Did total T3, did free T4, did TSH, all things that do not relate to symptoms. So I would suggest that you have your doctor check your free T3. And even if it's in the normal range, but toward the low end, the likelihood would be that you need thyroid replacement. And that would probably be slow release liothyronine twice a day. Next question, type 2 for 17 years. Now, I don't know if that's 17 years old or for 17 years. On insulin, some complications. current C-peptide is 0.6. Can that be from a fatty pancreas or just fewer beta cells? Well, I don't know if it's the C-peptide or what, but to my knowledge, there's no such thing as a fatty pancreas. Maybe such a thing exists and I just haven't heard of it. There is fatty liver, but if someone is diabetic, they have fewer beta cells. And if someone's a type 2 and obese, then they likely have insulin resistance in addition to fewer beta cells. I'm writing from the UK, and I wondered if you had seen some research recently reported on the BBC called Fasting Diet Regenerates Diabetic Pancreases. Well, if something is reported in the newspaper or on the media without a peer-reviewed article, it usually reflects usually reflects one, lack of success and a need for funding. So I suggest you look at the video and see if they refer to any peer-reviewed article in any reputable journal. My guess is that this is not a legitimate ball game. It could be that it's even placed by a company that's trying to put people on some kind of regimen for which they charge a fee. When going on your diet of 50 grams carbs a day, which is not my diet, my upper limit is 30 grams a day. I get protein in my urine along with ketones. Doctor wants me to stop the low-carb diet even though my blood sugars are great. When I go to 200 grams of carbs daily, the protein disappears. Any suggestions? Well, you might read my book, but protein in the urine can be a lot of things. It could be due to kidney damage, as I had many years ago when I was on a high-carb diet. Or it could be due to other ailments and other factors. For example, it was we recently discovered, with the help of hundreds of thousands of laboratory tests that were generated by LabCorp, we discovered and published that 40% of women have low microalbumin but high protein in their urines. And the implication is that this protein is globulin. And why would people have globulins in their urines? It relates to something unrelated to diabetes. So it opens up a new mystery. And why low carb would give you globulins in your urine, I don't know. This certainly is strange. Daughter is type 1 for 8 years, went on your diet, and her blood sugars were great, but doctor says to increase her carbs and use more insulin in order to grow. Now we're getting sugar spikes with the elevated carbs, et cetera, et cetera. Your suggestions? Well, it's been demonstrated in the scientific literature that kids go off their growth curve when their blood sugars are high, and they go back to their original growth curve, pre-diabetic growth curve, when their blood sugars are normalized. So your doctor is telling you the opposite of what is necessary for her to grow. What I try to emphasize for kids to grow is that they get a a lot of protein and enough insulin at their meals to keep their blood sugars normal with the additional amount of protein. And since most doctors don't know how much protein a kid should be getting, either you should read my book, Diabetes Solution, or you should get a nutritionist who knows more about protein. Well, I think we've finished our teleseminar for today. Thanks for listening to our March teleseminar. Our April teleseminar will be on Wednesday, April 26th. Look forward to your seeing me then. Please don't forget to visit Dr. Bernstein's Diabetes University. And if you don't have it, get my book, Diabetes Solution. See you in a month.